it's time to learn our recommended post-op suck training and tongue strengthening exercises. These exercises have been developed by physiotherapists and lactation consultants based on the tongue's reflexes that are present until up to 6 months of age. We call these playtime exercises because they are fun. Yes. Now, remember, the tongue is made up of 7 muscles that prior to the release could not function properly. These exercises focus on retraining and strengthening the tongue to function optimally. Over time, you will notice the tongue strengthening, toning, in a front to back and middle to outside direction. This is most apparent with a finger latch exercise that we'll demonstrate shortly. For these exercises, your babe must be awake, unlike Everest right now, and happy, therefore not crying, as when they cry, the tongue has a mind of its own. Feel free to do these exercises as much as possible. Great bonding activity for you and your babe. Now, as for positioning, unlike the stretches, you and your baby can be in any position that's comfortable. In front of you, on your lap, on your partner's lap, you name it. Now make sure you have washed your hands and that you have trimmed your fingernails, because the exercises do involve your hands going in your babe's mouth. Now let's get started with the first exercise, tongue pointing. The goal with tongue pointing is for your babe to open their mouth as wide as possible with their lower lip flanged downwards like a fish. Stick out their tongue towards their lower lip, ideally with a wide tongue as opposed to a narrow snaky tongue. Why we recommend this exercise? This exercise works their muscles that allow for improved breastfeeding. With their tongue forward and wide against your breast, it allows for optimal and comfortable tongue-to-lip seal for feeding and stimulates further milk production. Versus if babe's tongue stays behind that cute lower gum pad, it will trigger their gumming or biting reflex. That is both painful for mom and frustrating for hungry babe, as it does not lead to an efficient milk intake. So how do we do this exercise? With any of your fingers, you want to stroke or gently roll your babe's lower lip down with the juicy part showing, while also encouraging their mouth to open. Be patient and persistent. It will come. Repeat until your babe masters this exercise. You will see with time their tongue extending farther and wider, and many times they will point their own tongue after you do the exercise. I call these independent babies. When their mouth is closed, put your index finger in between their gum pads to have them open, and then you tongue point. Tip: do this exercise prior to nursing, as we want babe to learn that opening wide, lower lip flange, tongue out, all leads to best breastfeeding. The second exercise that also aids in improving breastfeeding, but can also be used to soothe your baby, that is after they've been fed, diaper change, etc., is the finger latch. For the finger latch, the goal is to place the finger pad of your index or middle finger against your babe's palate, roof of their mouth, stimulating that feel-good spot and triggering their sucking action of their tongue and surrounding muscles. As you continue to practice this exercise, you'll notice with time the tongue cupping your finger with a stronger suction force and strengthening in a front to back and center to outside direction of the tongue. This exercise involves many muscles, therefore be patient and practice this as much as possible. One tip: dip your finger in breast milk or formula, and once your babe masters this motion, bring them to your breast. Now, how to do this exercise. With the pad of your index or middle finger, place it inside your babe's mouth, gently up against their palate or roof of their mouth, and allow your baby to suck on your finger, ideally aiming for at least your first knuckle. Make sure both their upper and lower lips are flanged outwards, everted like a fish, meaning you should see the pink lips top and bottom. If not, correct them by flipping them out to achieve this flange. Once your baby is sucking your finger, pay attention to what the tongue feels like against your finger, as this will strengthen and change with more practice and time. Now, As your baby is sucking, gently move your finger back and forth in a tug-of-war motion without removing your finger from their mouth. This will increase your baby's tongue strength and overall sucking muscular function. For the advanced option, you can add additional resistance to their surrounding muscles of their lips. While babe is sucking, instead of the tug-of-war motion, as they're sucking with your non-dominant hand, gently lift and hold their upper lips upward or lower lip downward, alternating between the upper and lower lips. The last exercise focuses on tongue movement and is called side to side. The goal of this exercise is for the tongue to move to the left and right sides of their mouth, firing the action of muscles previously not utilized when restricted. How is this exercise done? With your index finger, place your finger pad centered on the top surface of their lower gum pad. Then with gentle pressure, you want to slide your finger along the top of the gum pad from the center to the right, following the gum pad, and then return slowly back to the center. The tongue should move laterally, following your finger. Repeat in one direction until the tongue successfully follows your finger. Then slide your finger from the center to the left side until your tongue follows, and then return to the center. Note, you always want to start and end in the center of the gum pad, so you don't want to be going from the far left to the far right. Center to the right and back, center to the left and back. When you're practicing these exercises at home, if you have any questions at any time, please never hesitate to contact any of our Little Bird staff. We're always here for you and your family.